So as you mentioned, doctor, that 100 daily doctor who have 100 OPD. When I go and I discuss that, doctors, your maximums work, whatever you are discussing and talking, AI can do or technologies can do. They are not ready to put initial time. So why do you think they are not ready right now to put initial time? And even though I say, if you are not putting right now time and effort, so in the futures, like other doctor who's using, they also, like, they can take your patients, because your patient get used to experience of that kind of experience. What do you say on that?
So we need to look at it in three different angles, Ramesh. One is fear of technology. Second was time constraints that we talked about. Third is adaptation. Now, what is this fear? They feel that this technology is not for me. It is something that is beyond my understanding. I think that a person who has done his MBBS and a person who has done his MD, the amount of vigorous training that they have undergone, learning these smaller nuances related to adopting minor technology is not going to be any great. How long will it take for us to be averse to any of those technologies? I'm giving you a simple example. Something like a voice to text scribe, which is available. These are AI enabled tools. Now, these AI enabled tools, if you are just able to adopt this, there is something called as an Eka Care, which is a company which has got this. So you just need to enable this into your EMR, and then the entire conversation that you have between the patient and the doctor gets automatically recorded in its specific subdivisions of chief complaints, history of present illness, past history, provisional diagnosis, investigations, treatment. It automatically gets recorded. Now, what is it that you are doing? You're not doing anything at all. You're just continuing with your normal flow of conversations that you have.
Right.
Second, if this conversation that you're having is going to automatically go ahead and digitize a prescription that needs to be generated for a patient.
So you discuss that, discussions have converted into text, text is converted into prescriptions.
Yeah. And imagine the power of this when you have a digitized format of your prescriptions and you have an AI tool to analyze these. Now, all these things is enormous amount of use for us in the days ahead. A person who's treating 100 patients, a doctor who's seeing 100 patients per day, imagine he has got close to almost around 30,000 patients at the end of a month.
Right.
He has got 3 lakh patients at the end of a year. And by the end of 10 years, the amount of data that he's got is enormous. And we are losing out on all those data that is not available for us for clinical research purposes. And if we were able to utilize all these things, it is going to be enormous amount of use. The government has taken huge steps with the digital mission in the health, the ABDM that is happening, each ABA ID that has to have. Now, if